We're starting to understand more and more that eating disorders are really based in anxiety in lots of different ways. We also know that even after weight restoration, for up to a year or two after weight restoration or cessation of symptoms from eating disorder treatment, there's a lot of anxiety that remains, and those anxiety symptoms can actually become the much more problematic thing even after treatment. So the idea behind exposure and response prevention is that you put somebody in contact with the feared stimulus or the feared situation. In our case, it's going to be food or some sort of food-related situation, for example, and then prevent them from engaging in the behavior that they might normally engage in to alleviate that anxiety, whether it's purging, whether it's exercise, whether it's not eating the food that's put in front of them. These exposures can go beyond things that are just food-related or just even eating disorder-related. All of our passes are designed to have some therapeutic purpose, not just be sort of a break from treatment, for example. A lot of our patients have tremendous social phobia, so just being out in the community in a way that's different from how they normally are can be very anxiety provoking. So we educate our patients on this whole anxiety process, the normal time course of anxiety, for example, as well as explaining to them what the purpose of these exposures are and why they have to be done, over and over again, so that eventually you learn that no fear signal. You learn that the feared consequence doesn't occur and that over time anxiety does go down. Without that actual experience, it's hard to convince somebody who's fearful of something that they don't have something to be afraid of, because for them that fear is very, very real. So we would prepare with them and help them design some level of graduated exposure to ultimately then go out into the public and challenge some of their worries about what's going to happen when they get out there. Another really essential component of exposure and response prevention that really fits with our overall clinical approach is that you have to collaborate with the patient. When you're coming up with an exposure, it can't be an exposure that everyone does, because it's not going to have the same meaning. It needs to be intentional, it needs to have a particular purpose for this person, and the only way to design those things is to work very collaboratively with the patient. And it's a big part of what we do in all aspects of the program. So if you'd like to find out more, you can go to reasonsedc.com.